Good morning. Yes, I feel the way I look. Except it's even worse because I think the stress of my mother is causing me. My brain is so splattered and scattered, and I feel like I'm like losing my mind too. Anxiety is bad. I had diarrhea again this morning. I think it's got to be the Flagyl. I've been on the Flagyl for 3 days, and I start getting diarrhea. This is exactly what happened last time. It hasn't been horrid, but I definitely have diarrhea this morning. I slept okay. I mean, I woke up many times, but I just feel like I don't have much left in me. I really don't. I don't feel like I have much left in me. I already called to see if my mother could get in to see the doctor, but the doctor's not in today. They're sending a nurse out to collect a urine sample to check for a UTI, which is very common for altered mental status, but I'd be surprised if she's got a UTI. I think it's just her dementia. My tinnitus was really bad last night for some reason, and I mean, I always have it, but I can ignore it, but last night it was like blaring. I don't know what that's all about either. So I'm just checking in and letting you know it's another morning of hell. Another morning from right out of the pit of hell. So bad. I'm gonna attempt to get on the treadmill in a little while though. Because me sweating on there, is that clearing my pathways? Somebody explain this pathway clearing business. I can't read up on it. I don't understand. When I dry brush and I go in the sauna and is that clearing the pathways or is that detoxing? I don't understand any of this. It's just too much. It's too much for me to take in. I had my appointment at 3 o'clock today. And I've been praying that God will give her the gift of knowledge. But I've prayed that for many doctors that I've seen, that the Lord would just give these people the gift of knowledge to know what to do for me, to know what I need. I can't keep going on like this. Right now, I feel like my heart is pounding out of my chest, but it isn't. My pulse is normal. Well, that's my morning. Sorry. It's like this every morning. My mornings are hellish. Hellacious. Every morning. Bye. Okay, update. Now my mother has fallen. I just heard from the nurse at the clinic that they found that she has fallen. She's got a bloody lip. Her denture is stuck in her mouth. They're trying to get her they're making arrangements to bring her into the clinic to see somebody. I'm just about ready to just say, Con, I gotta go. Hi. Forgive me, but I'm a wreck. I had to fly over to my mother's because she had fallen, and it just got to the point that they said she has to be sane, so she's either going to the emergency room or we have to see her now at the clinic. And I knew she wouldn't go with the driver. They said the driver's on his way right now. So I had to fly over here and have a screaming fit because she was like a 5-year-old. I'm not going. She wouldn't get out of her bed. I'm like, do I have to pick you up and throw you into the chair? I lost my temper. I didn't touch her. I would never touch her, but I was yelling at her because I can't do this. I have no patience. I can't do this. How do you do this when you're this sick? I called her a bitch. I said, you're being a bitch, and I started screaming. I'm like, I'm not doing this for my own good. You got to get up, Mom. You're sick. You fell. I didn't fall. She doesn't even remember falling. You got a bloody lip, Mom. That happened a long time ago. I'm like, oh my God. So I'm just popping in because I can't take it. I can't calm down. My anxiety is off the charts right now. I feel like I can't breathe. I can't take this. And I don't know why God is not. I'm sorry. Goodbye. Hi. Sorry about that outburst. I just don't know how you're supposed to handle this kind of stuff when you're this sick. I don't know how you're supposed to do it. But I'm home. I had to calm myself down because my blood pressure was wicked high, and clearly it would be. So I'm just having a bowl of soup right now and just trying to bring it back down to normal because I have my doctor's appointment later. I totally understand elder abuse now. I see when you have a parent who has become a 3-year-old and they refuse to comply with what you're trying to get done and you're just doing it for their own good. A 5-year-old, you put over your knee and spank them. And I don't care if some of you don't believe in spanking. I do. But can't put a old person over your lap knee, can you? And that's what she needed. She needed a severe spanking right now then. But anyway, it is done. She's on her way, and we'll find out what they find out. Something's got to change, though. I can tell you that for sure. Later. Say hi.
Who's that?
Say hi.
I can't see.
It's you. This is my son, Sydney Michael.
I know it's me. I'm saying I don't know who I'm talking to.
Oh, this is my vlog. For my vlog. I do a vlog.
For who? Who watches these?
People like me have no life.
Don't show me like this. I'm a wreck.
He's hungover.
Yesterday was Super Bowl.
He won $700 from the Super Bowl, and he drank probably 90% of that $700. Just thought I'd introduce you to my son because he only comes by once every 5 years. Say hi, Sid.
I said,
Are you on there?
yeah, kind of. Not anymore. It's hard to drive and do that.
Where are we going?
Doctor of Functional Medicine.
On our way. Let you know how that goes. Hi. I'm home. Got in my bed and got into my cuddle duds. The appointment went really well. Really well. She had so much information and took notes for me. Being treated for chronic mono. We're not quite sure on the Lyme diagnosis any longer. But chronic fatigue and chronic mono, definitely. And the mono would have caused the chronic fatigue. Anyway, let's see. Getting off the antibiotics. Almost 4 months on it. Well, I'm into 4 months on it, and has made no difference at all. And all it did was cause more diarrhea. So anyway, so as of today, I won't take my second dose of azithromycin, and I am all done with the azithromycin. I will take the amoxicillin as prescribed twice a day for 3 days. Then for 3 days, I only take 1 dose of the amoxicillin, and then I'm off. I'm not taking any the supplements he had me on either. Stopping everything, nothing, except for my vitamin B, my vitamin C, my coconut oil, and my vitamin D. For 1 week, I leave it like that after I'm off the antibiotics. Then for 1 week, I do nothing. I can't, my mind's going. There's something about 3 weeks I'm doing a process. But as of tomorrow night, I am starting LDN. Now, the Lyme naturopath I had seen 2 years ago, I think it was, that was the first thing she wanted to put me on was LDN. She had suggested LDN, low dose naproxen, but I didn't follow up with her. So we talked about it and the benefits for it and what she has seen, how it's worked. She's starting me at a lower dose than the starting dose is, which the starting dose is 0.5. She's going to start me at 0.25 at night and see how I do. And I'm willing to try it. I'm willing to try anything at this point. I really feel safe with her. She said, I'll keep seeing you until you're all better. We're going to get you better. She talked to me about my exercise. That because if I have Epstein-Barr, I have chronic mono, that I have just been depleting myself with this exercising the way I am. She goes, a body at rest stays at rest, so she agrees that I need to move and not stop moving, but to not do what I've been doing. So 20 minutes at the most. She said at first, at really 10 minutes. 10 minutes, 20 minutes, and then stop. She also said about the detox, which I don't know. I guess I got confused. I thought that you're supposed to detox a lot of different things. She said, no. One at a time. So if you dry brush, that's a detox. You don't dry brush and get into the sauna, or get on the treadmill and then get in the sauna and dry brush. And I said, that's what I've been doing. I've had days that I've gone on the treadmill, then I dry brush, then I get in, and she was like, and then I'll take an Epsom salt bath. And she's like, do one of them. You're making yourself sicker. So for some reason I thought dry brushing was part of going in the sauna or going into the Epsom salt, but it's just another detox. And she doesn't agree with doing multiple detoxes. She goes, you're just releasing the poisons all, and you're not getting rid of them fast enough. I'm trying to remember everything she had said. I just feel validated now. Oh, lymph nodes. She felt them. And actually, while I was there, they are smaller right now. And I said, they do. They'll get smaller, and then sometimes they feel like they're button. She goes, because they're filtering. They're going up and down with the mono. They're filtering the poisons. So, her suggestion, and it's all up to me, is to watch and wait and see how I do with this. She does not believe for a second that it's cancer. Not for a second. She just doesn't believe it. She believes that it's the mono that's causing these lymph nodes to react like that, especially since when she felt them, and she really palpitated my neck and said, they're smaller than they were when I was at your house last. And then I stood back and I felt them. I go, well, they are right now. How weird is that? They are smaller than, but sometimes they feel like they're bumping out. And she goes, well, that makes sense. She goes, now if your blood work and other things came back and you were losing weight and you had but you don't have any other symptoms of the lymphoma. Does EBV cause lymphoma? Yes. So, but going back to, I feel validated by her. She hugged me. She hugged my husband. She's just very, like my husband said, Sid said on the way home, he goes, she just seems so knowledgeable. Like she really has done, and being an integrative doctor, she's pulling in the natural stuff with medication. She's not like one or the other, but she get off the antibiotics. And I was like, I'm all about getting off the antibiotics. So I'm sure I'm forgetting stuff. Oh, Olive and Sid's got to pick them up tomorrow from the from a pharmacy. Olive leaf and something else. I can't remember, but there's other two things that I got to start taking. Antimicrobials, or I don't know. Oh, no, the LDN he's picking up from the pharmacy, but he's also have to go to the natural store and get the olive leaf and something else. Can't remember, and I'm too tired to even go downstairs. She said, look at you. You are exhausted. And I said, I am. I feel hungover. I feel hungover every day. I just like, she's like, yeah, because, and she went through all the labs with me and explained the numbers and explained it to me. Chronic mono. She goes, you don't remember ever getting sick to begin with? And I said, no. I've been sick for a long time, but I don't remember all of a sudden on onset. She goes, because people get mono and they're in bed for 6 weeks. I go, it never happened to me. I've just been getting sicker and sicker and sicker and sicker and sicker and sicker. And again, we discussed the fact that my husband and I were talking about how I really believe that I wasted several of these years fighting the benzo and trying to, and weaning and shaving and weighing the benzo and all about benzo. In the meantime, getting sicker and sicker and sicker because I was being told it was nothing else. It was only the benzo that was making me like this. In the meantime, I am sick. My labs show it. Makes me so angry, but can't get that time back. I'm really dizzy. When I got out of there, my head was like really bad for whatever reason. Maybe because it's just information overload and I don't know. And then we were talking about his mother. Sid was telling me that he was standing at the stove cooking the other night, and he just said it. And all of a sudden, this overwhelmingly sadness for my mother, missing my mother. And he goes, and I started crying, and you had come into the room, Lane, and you didn't even notice, and just wiped your tears. And I said, honey, why didn't you tell me? Tell me when you're having those moments. And I said, because I cry about your mama. I miss his mom really bad. You should know if you've seen any of the other videos that she passed away in October. Closest thing I ever had to a real mom. So yeah, I miss her too. Because this is a woman, in all the pain that she ever had, she always put you first. Didn't matter what was going on in her life. It didn't matter what was happening with her body. If you were hurting and needed, she put you first. That's just the way she was. She just always put you first. And I miss her. I miss talking to her. So I know Sid is hurting too. And we had a good talk on the way home. But Sid feels the same way. He goes, I really feel safe with this this woman. I feel like she's got our back. So I pray that this is the right path. She said something funny. She said, when I take the LDN, the first pill, tomorrow night, and I put it in my hand, she goes, I don't want you to just pop it in your mouth. I want you to hold it in your hand. And I want you to be thankful for it, because it's gonna be the thing that's gonna help you. I want you to be thankful for it. I thought that was kind of funny. I like, well, I'll be thankful to the Lord, I guess, but. So I'm sure there's more. I'm babbling. There's so much. We literally hour and a half. She spent an hour and a half with us. And she said she's gonna get a hold of my GP and because they know each other. They have a couple patients that they share, and she said, so I will get a hold of your GP. I'm not going to use her name, and we'll have a very intense discussion in regards to your health and what's going on with you. So we're on the same page. I don't want to threaten her, and I want her to know where I'm coming from and where she's. And I'm like, please, yes, do it. I'm exhausted. And she said, you're not resting. And I looked at Sid and I said, that's all I do. And he goes, no, you don't. No, you don't. And I go, honey, I'm either on the couch or on my bed. He goes, but you don't rest. He goes, you're on your computer. You're on your phone. You're on your tablet. You're on the phone. He goes, you don't just rest. And she goes, the blue light from the tablet and I said, and your computer, and I said, I know all about that. And I go, but I do read. I read books. And she goes, that's very good. You gotta rest. And Sid looked at her and he goes, my wife does not know how to rest. And I'm like, I am. I'm too jumpy. I'm too antsy. She goes, well, that's all gonna get better. She tells me the LDN is gonna help my sleep. Oh my God. If it does, that will be a huge twinkle. That would be a huge twinkle if I could get some sleep and rest and just feel better. And the dizziness, the neuropathy, all can be, and she's saying, is all from the mono. And she goes, and these numbers, when you got hit with it, you got hit with it hard, really hard, and you just kept fighting against it. You just kept going, and never, because if you had gotten into bed and taken care of yourself, it would have passed. Now you've made it chronic. And I have candida in my gut. So I'm upping my coconut oil to 2 tablespoons a day. So I'll get back to you tomorrow. I'm all done vlogging. Thank you for taking the time out of your day to even watch this. And Lord willing, we'll be back tomorrow. God bless you.